Bismillahirrahmanirrahim. I'm Dr. Yasmin Ahmed. Today I'm telling you about the diseases of adrenal gland. First disease, it's a Cushing syndrome. It's basically due to the hypersecretion of ACTH by the anterior pituitary gland, and it's basically you can say about that it is due to the negative feedback effect of increased cortisol. So in Cushing syndrome, you could see the some features. As you can see in this diagram, a person may have some personality changes, hyperglycemia, moon face, increased susceptibility to infection, CNS irritability. In males, the most prominent feature is gynecomastia and fat deposit on the face and back of the shoulder. In female, there would be amenorrhea, hirsutism. Amenorrhea mean absence of menses, and the hirsutism is appearance of fine hairs on the face, on the chin, on the side of the face. And thin skin, purple strias, bruises, petechiae. Bruises and petechiae, purple stria, the purple lines present on the skin. Bruises and petechiae means there would be accumulated blood beneath the skin. There would be thin skin, osteoporosis, weakened bone. So these are some features a person having a Cushing syndrome will have. The other disease of adrenal gland is Addison disease. It's basically adrenocortical insufficiency, in which there is decreased secretion of the both glucocorticoid and mineralocorticoid hormones. There's decreased secretions of cortisol and aldosterone. So this is a picture of a woman showing the Addison disease. Most prominent feature would be seen. There would be a bronze pigmentation of the skin color changes, pigmentation, changes in the distribution of body hair, GI disturbances, weakness, hypoglycemia, postural hypertension. Postural hypertension mean there would be when there would be a change in the posture of a person from sitting to standing, there would be a hypertension. Weight loss. So there are some features which are present in a person having Addison disease. Okay, now today's most important topic is pancreatic island. Pancreatic island in pancreatic gland. There are importantly three cells present in pancreatic islets: alpha cells, beta cells, and delta cells. Alpha cells secrete glucagon, and beta cells, those are most numerous, secrete insulin, and the delta cells which secrete the somatostatin. Okay, the uh, normal blood glucose level is 3.5 to 8 millimole per liter, and in other units it would be a 63 to 144 milligram per 100 ml. So blood glucose level are controlled by opposing action of insulin and glucagon, antagonizing the both effects. Like glucagon increases the blood glucose level while the insulin reduces the blood glucose level. You can see here the pancreatic cell arrangement. On the extreme peripheries, you could see alpha cell that secretes the glucagon, and the inner side, the numerous cells, those are beta cells that secretes insulin, and the blue one, few cells, delta cell, that secretes somatostatin. Apart from these, there are some F cells on the peripheries that also secrete pancreatic polypeptide. But it's not most important to memorize these F cells, but you could see the most importantly the three type of cells: alpha cell, beta cell, delta cells, and the three major hormones being released from these cells. So most numerous cell, beta cells present. Okay, insulin, as we have yet studied, that insulin is being secreted from the beta cell of pancreatic islets. Its secretion is being stimulated by the increased blood glucose level after eating a meal in a parasympathetic stimulation. In a parasympathetic stimulation is basically a rest and digest condition in a raised blood amino acid and fatty acid levels, and in GI2 hormones like gastrin, secretin, and cholecystokinin. So these are some factors in which the secretion of insulin is being stimulated. And there are other factors in which the insulin secretion is decreased. Those are the sympathetic stimulation. Sympathetic activity is known as fight and flight activity, sympathetic stimulation. Glucagon, adrenaline, the other name of adrenaline is epinephrine, cortisol, and somatostatin. And GHRIH is growth hormone releasing inhibitory hormone. Okay, these are some functions of insulin. Most important function, it reduces the glucose, amino acid, and fatty acid level in the blood. It increases the uptake and use of glucose by the cells, and it decreases glycogenolysis, mean the breakdown of glycogen into the glucose. It also prevents gluconeogenesis, means the formation of the new sugar or new glucose. It increases the conversion of glucose to glycogen, means glycogenesis, especially in the liver and skeletal muscle. This conversion of glucose to glycogen is being held in the liver and especially the skeletal muscles. And most important function of this insulin, it increases the synthesis of protein as well as it promotes the synthesis of fatty acid and storage of fat in the adipose tissue known as lipogenesis. Okay. Diabetes mellitus is a diseased condition in which there is a deficiency or there is absence or impairment of insulin activity. When there is impairment of insulin activity due to the receptor changes or due to the destruction of insulin receptor, that's may also known as insulin resistant. So there are two type of diabetes mellitus, type 1 diabetes mellitus and type 2 diabetes mellitus. In type 1, it's also known as IDDM, it's insulin dependent diabetes mellitus. It's majorly autoimmune disease and it usually occur in children and young adults. And it's sudden and can be very life threatening. There is severe deficiency or absence of insulin secretion due to the destruction of beta cells of pancreas, beta islet cells of pancreas, and treatment is insulin. So most importantly, there is the destruction of the beta islet cells of pancreas, and its destruction is due to the autoimmune diseases or autoimmune antibodies, and it usually occur in children and young adults. And other name of diabetes 1 mellitus is IDDM, insulin dependent diabetes mellitus, and treatment of this type 1 is insulin. We will give the patient of type 1 diabetes insulin. Okay, the other type is type 2 diabetes mellitus. The other name is known as NIDDM, non-insulin dependent diabetes mellitus. There are some causes of this type 2 like obesity, sedentary lifestyle, increasing age affecting the middle age and the older people. This type 2 diabetes mellitus usually occur in a middle-aged person from 35 to 45 or 50 years. And most important cause of this type 2 is genetic, mean it's hereditary. Okay, these are some effects of diabetes mellitus seen in a person having diabetes. Raised blood glucose level, raised plasma glucose level, there will be glycosuria, there will be glucose present in the urine, polyuria, excessive urination, urge to urinate, polydipsia, extreme thirst, weight loss, ketosis and ketoacidosis, comma, ketosis and ketoacidosis means coma due to the raised ketoacids in the blood. So that condition is known as ketosis and ketoacidosis. Okay, picture showing here, there are some symptoms. A person having a diabetes, always tired, frequent urination, person always urge for urination, there would be a sudden weight loss, and there might be a wound that won't heal, person is always hungry, there might be a blurry vision, and there would be numbness or tingling of hands and feet, and person is always thirsty. So from these symptoms you can say the person may having a diabetes mellitus. But the other factors from the age and from other causes, you can say that there would be type 1 or type 2. Okay, the other hormone of the pancreatic islets is the glucagon. Glucagon hormone is released from the alpha cells of pancreas. Its function is increases the blood glucose level, and it converts the glycogen to glucose in the liver and the skeletal muscles. It promotes the process of glycogenolysis, and it promote gluconeogenesis as well. So these are the functions that are opposite to the functions of insulin. So glucagon is being stimulated by the low blood glucose level and exercise. When there is low blood glucose level and exercise, the glucagon is being released, and it's decreased by somatostatin and insulin. Okay, the third hormone of the pancreatic islet is the somatostatin, also known as growth hormone releasing inhibitory hormone. It inhibits the secretion of both insulin and glucagon, in addition to inhibiting secretion of growth hormone from anterior pituitary. You can see it inhibits the secretion of both hormones, insulin and glucagon, in the pancreas, as well as it inhibits the growth hormone release or secretion from the anterior pituitary. That's why it's named as GHRIH, growth hormone releasing inhibitory hormone. So today we end with this glucagon hormone and these hormones of pancreatic islands. Thank you so much.